Today I'm going to talk to you about how the organs and the brain and the muscles all intercommunicate with each other, and that one of the goals that I have for my patients is for us to see how they're all connected and using that information to give you what I call holistic care. So let's talk about how they're interconnected. So first of all, the brain and the muscles. So there is a somatotopic map of the brain that includes different body parts. And so the thumbs have a huge representation, the big toes, the tongue has a huge representation, the genitals have a huge representation, but the whole body is mapped out on the brain. And the legs are basically in the center, right through here, and then the arms are over here, and then you have all these other body parts in between. But the brain affects muscle groups that are in these areas through this somatotopic map. There's also a cerebellar map of the brain, and the cerebellum is basically the last frontier that we're still discovering of the brain. Most other areas are much more mapped out, but we're still figuring out this map. And my own personal opinion is there's also going to be a viscerotopic map, meaning that the organs are also represented in this area, because we know that the cerebellum affects blood pressure and gut function and things along those lines. So also though, there is a spinal cord connection. So there's information that goes to the brain via the spinal cord, and then back from the brain back down to the muscles. So that's the brain and muscle connection. So now there's also a connection between the organs and the muscles, and that's also in the spinal cord. So information goes from the spinal cord to the muscles and to the organs, and then back to the cord again. So communication happens in the cord where the fibers overlap each other. There's also a connection between the brain and the organs through what's called the nucleus tractus solitarius and the nucleus ambiguus. This is in the brainstem. There's also a polyvagal system, which is very complex, but this comes from the lower part of the brainstem via the vagus nerve, and it travels into all kinds of different areas of your organs, including basically all of them, except for right here, which is called the splenic flexure, and going down. So the last part of your colon is not innervated through here. Also, there's a spinal cord connection as well for the brain and the organs. And then there's a viscerotopic map of an area called the insular cortex. So this insular cortex is what is activated through acupuncture. And being that with acupuncture you can affect organ function and you can also affect pain. It's a very interesting area of the brain because also emotional pain lights up this area. So there's also an emotional correlation. Another thing that we should talk about are something called cytokines. These are molecules that basically communicate back and forth between the gut and the brain. So if the gut is inflamed, the brain will be inflamed, and vice versa. So what causes these miscommunications between the organs and the muscles and the brain is different things like muscle injuries, hormonal issues, brain injuries, cardiovascular issues, a poor diet, gut inflammation, any kind of immune issue or any kind of pulmonary problem can create this. So as a chiropractor, what I think about is if we want to get into the cause, we always have to look at what muscles are weak, because weak muscles are what create the misalignment. So in order for a muscle to be weak, there's going to be some miscommunication between these different things that we just talked about. And when a muscle is weak, another muscle will tighten, and then that causes the bones to go out of their place, and it creates joint position error or misalignment. So I recommend for my patients that are interested, if you want to get into how these are all interconnected and use this in your treatment, I recommend that you schedule full appointments, and a full appointment is basically as much of a 15-minute time as possible where you're not double booked with another patient, or scheduling longer appointments. Some people like to do 30-minute appointments, so we can really get into things that are going to stimulate and drive the brain, things that are going to help fix the muscle issue, or things that are going to work on treating the organ. So that's my that's what I want to talk about today, and I will talk to you next time.